throughout my lifetime, year after year, serious depression and anxiety have risen in the United States, in Britain, and across the Western world.
We are undoubtedly in the midst of a global mental health crisis. According to the World Health Organization, suicide is the second leading cause of death among 15 to 29-year-olds. The most connected generation is also, statistically, the most depressed, anxious, and medicated generation. This is leading to various brands beginning to board the mental health wellness train with AI depression detection and digital therapeutics. All of this is to say, people are not well. But with this rise in global mental health awareness, another shift is taking place, and that is in the way we treat it chemically.
If your brain were a computer, think of ketamine getting in there and fixing your broken hard drive.
This is Dr. Glenn Brooks, a Harvard-trained anesthesiologist who in 2012 opened one of the first ketamine infusion clinics.
Ketamine is a synthetic drug. It's actually a close cousin to phencyclidine, PCP, first derivative. But it's been with us now since the mid-60s. For the first 25 years, ketamine was used mostly as a general anesthetic agent. In hospitals, we used it in operating rooms, emergency room. All my kids have had ketamine for wisdom teeth extractions. About 30 years ago, though, it found a new role treating post-traumatic stress disorder. Kind of an accidental finding by the military during the first Gulf War. So what ketamine does, very different than other medications. It starts a cascade of neurochemical events, including brain-derived neurotropic factor, the BDNF, and begins to stimulate new dendritic and synaptic growth. So what ketamine is really doing is restoring mood center structure, normal mood center anatomy. It's not a chemical fix, it's actually an anatomic repair.
I'm Kate Reed, I'm 25 years old, and I found ketamine because I had treatment-resistant depression for most of my life. Started dealing with it when I was 14 years old. I'm at session 4 right now out of 6. What I thought that it would be ended up being very separate from my actual experience, just because it is really high dose ketamine. And it's very intense. When I get there, this office is very it's like a holistic health center. So I take my shoes off. Actually, he'll prepare the medicine because it's usually in a vial and it's by intramuscular injection. And I lay down on a couch with blankets on me. It's really comfortable. You have eye pillows on the whole time and headphones. And there's actually a curated playlist that he uses. So that's when I'm having the bulk of the experience itself. I felt results after 2. And a lot of people, it's pretty typical. The first one, you're really getting oriented. The biggest thing for me is I feel more present day to day. If you're truly in the present, there's much less to be anxious about. Mostly it's when we're way ahead of ourselves or anticipation or thoughts of the past.
You have to remember that we're dealing, for the most part, with survivors of childhood traumas. And the last thing that they want to deal with are flashbacks, or recalling events. They don't want to lose control. So people don't come into our office actually asking for that experience. There is absolutely no need for anybody to have an extreme dissociative, hallucinogenic, psychedelic trip while receiving ketamine for the ketamine to work.
With ketamine clinics popping up around the globe, companies are starting to pay attention, using ketamine as one of the first tests for psychedelic mental health care. But the drug still holds a stigma.
I very much grew up with this conception that psychedelics and especially ketamine, and when I was probably 15, 16 in high school, were bad. It was just a bad thing. It was very binary, good and bad things that you should be doing.
These substances are extremely dangerous. There's a medical risk to the brain and body. Perhaps the biggest risk is the placing of the psyche in peril.
If you give somebody psilocybin or ecstasy or LSD, you don't know what's going to happen. You're absolutely right. You don't know how long they're going to be there. You don't know when it's safe to let them leave. And with ketamine, that's not an issue. We're 2 blocks from Wall Street in Manhattan. People leave our office and go back to work and start trading your money.
This cultural shift that we're undergoing in the last 5-6 years or so has really been transformative to the way that people view things. In the past, we're kind of being archaeologists of our own past and undigging all of these things and realizing that what our perception was built on in the first place was stipulated by so many other things that we didn't even consider. More conversations about the war on drugs and stigmatization of treatment in the first place. And I think people have a better understanding of why we view these things from the social lens that we do.
A few changes seem to be taking place simultaneously. A global societal movement towards awareness, the destigmatization of emerging therapeutics, and the support of medical science. There is little doubt that this landscape is shifting, and shifting quickly.